All right, Dr. Orlander, tell us how you ended up at UT and what keeps you here. What do you like about our institution?
So I came in 1983. It was a very different place at that time, but it was a very impressive place even then. So I think when I came here to interview, I saw all these amazing buildings and the hospitals and the campus and everything was on the same street. And so the opportunities looked like they were endless, including both, the medical school as well as all the associated facilities. And then the people were super nice. So that gave me a good feeling. What keeps me here, I think, all the people that I met at that time, many of them are still here. And, just getting to know them and working with them has been really a pleasure. And so many of our students became our residents, so many of our residents became our faculty, and they're still here as well. So I think it really became a very family-like environment.
Tell me a little bit about your role and interactions with the residents now.
So I came with a vague interest in education, and that quickly increased over time. So I started with doing what usual people do in terms of rounding with the residents, and which I really enjoyed, and doing conferences. And then I kind of grew into doing more administrative and curricular type activities, both with the students and the residents. And then I became chair of the curriculum committee, running courses, and eventually interim chair of the department, as well as residency program director. So my interactions with the residents have varied quite a lot over the years, but really getting to know them personally has been the most rewarding piece.
Wow. So, how would you describe a UT resident? What do you like about them?
They're very open, very engaged in learning, and especially interested in taking care of patients. And I think that they work well together. They enjoy a teamwork environment, and they're very collegial and collaborative. And I think that's what really makes the discussions and the care of the patients so interesting. And they always do a great job in taking care of the patients.
And then tell us a little bit about the clinical environments that we have here at UT and how those contribute to the learning environment.
Yeah, so we have obviously multiple different hospitals that we go to, and the hospitals are very different. And I think that that really gives the resident an eye on what kinds of different institutions are available, and how healthcare systems are constructed. So that would give them an idea of what they want to do in the future. So places like the VA or LBJ or Memorial Hermann, MD Anderson, they're all very different. And I think that the residents really get a superb view of every kind of medicine and every kind of patient.
I know you've also played a large role in building the endocrinology division. Can you tell us a little bit more about that division and how these different clinical environments look through that lens, and then maybe also about some of the scholarly pursuits of the endocrine division that would be available for residents to get involved in?
Yeah, I think I'm very proud of my division. Again, they're very collaborative. They work well together, and many of them have kind of grown up with us. There's a fairly broad range of interests across the different facilities that we go to. We work extensively with our friends at MD Anderson, many of whom were our former residents and fellows, in terms of endocrine neoplasia. We have a large pituitary practice that probably is the biggest in the city right now. We do a lot of thyroid surgery. We have a very large diabetes population, and we do reproductive endocrinology as well. So we pretty much cover all of the bases in terms of every piece of endocrinology. And all of the faculty are very interested in teaching, and they're all very much involved in both the students and the residents. So I think that interaction really pulls them into our scholarly activities, which is anywhere from looking at some of the basic work in terms of diabetes care, where our faculty like Dr. Gutierrez has an RO1 in association with our Brownsville group, looking at underserved populations and diabetes and its mechanisms, as well as a lot of quality improvement projects related to diabetes in the hospital, osteoporosis. So there's a lot of activity and a lot of opportunity for scholarly work.
What do you think are some of the exciting scholarly opportunities in the department overall?
Yeah, each of the divisions is very strong in terms of research, and there are numerous faculty members that are willing and interested in having residents and students work with them. So I think, cardiology, oncology, infectious disease, rheumatology, they all are very strong in terms of both basic and clinical research.
Wonderful. And then I know you've lived in Houston a long time, so are you comfortable telling the trainees and applicants anything about what you like to do for fun outside of the hospital or any, hobbies you have that help you enjoy our city?
So I'm originally from New York City, and so I'm used to a pretty active cultural scene. So I really enjoy a lot of the opportunities in Houston, whether it be all the new museums that they've built, and we did have live theater, which I hope will start soon. So there's music and other cultural activities going on all the time. Restaurants are great. So I think that it's a much easier city to live in than in the middle of Manhattan, and it has lots of the same things to offer.
Thanks. And then is there anything else that you think that applicants should know about our department or our residency program that I've forgotten to ask you?
I think that we're very welcoming, that we want to make sure that everybody feels both respected and accepted, and that all of their opinions are solicited. And it's important that we all communicate well together. And I think that our residents do a great job on doing that.
Thank you.